So you may wonder if Ultherapy will work for you. The answer to that is that it absolutely will work on every patient if the treatments are given properly. So what I've discovered is that you need to deliver the number of lines closely spaced together to result in a good response. You need to have that heat being directed to the SMAS or the fascial layers in order to get them to contract and produce a lot of new proteins. So, in if you, for example, there's 800 lines being delivered to the lower face, and that takes an hour and 15 minutes to be able to do. So you need to have a thorough treatment. Sometimes we add extra lines when we think a patient really needs a little bit more lifting in a particular area, and that will result in a therapeutic response. The second thing that's required for a therapeutic response is that the energy be delivered at the appropriate depth and in the appropriate location. So you have to become an expert ultrasonographer in order to deliver these treatments appropriately, and you have to be constantly monitoring this display on the device itself in order to know that you're putting it at the proper depth and the proper location for that given patient, because it does vary from patient to patient. So we're looking here, for example, at the ultrasonic display where you have the epidermis, the dermis. This is the subcutaneous tissue. This little bright layer of discontinuous dots, this entire thing, is the fascia and the connective tissue that you're targeting with the ultrasonic device, and below that is the layer of muscle that's black in this illustration. This is actually what we see when we look, and this changes from location to location. Sometimes there'll be a blood vessel or there'll be a bit of bone that you have to avoid. And you also have to be sure that you're not hitting the fat, because you don't want to target the fat unnecessarily. You don't want to be up this high, because that can cause the patient to lose fat in their face, and that's not necessarily something that somebody is looking for. So you have to target at the appropriate depth, 1.5, 3.0, or 4.5 millimeters, and the appropriate depth for that patient's facial anatomy at that location. If those two principles are followed, an adequate number of lines delivered closely spaced together, and number two, an adequate location and depth for that patient, you will get a good response from Ultherapy.